Hello, and welcome to Revive Health's Daily Briefing Live for Tuesday, May 26th, our 30-minute review of the latest and most important news, resources, and advice for health system marketers and communicators dealing with COVID-19. I'm Luke Farkas, your guest host for today and tomorrow. And I'm joined here by Chase Kleckner, Senior Marketing Manager at Revive Health, and our show's producer. Hey, Chase.
Hey, Luke, good to have you on the show.
I'm glad to be here in a different capacity from last week as a
That's right.
guest.
Yeah.
So it's a good time. Today, we're also joined by Mike Patron and Matt Gully. Mike Patron has really spearheaded a lot of our health system related tracking of news over the past few months related to COVID-19 and as it's kind of made its mark on the United States. Mike's also supports client services efforts pertaining to thought leadership, organizational communications, earned and social media, issues in crisis, and analytics. He has a strong track record of storytelling and helping clients leverage communications as a way to function more effectively and ensure alignment internally and externally. Hey, Mike, glad to have you here.
Hey, Luke, thanks for having me. Excited to be here.
Yeah. And then we have Matt Gully. Matt is joining us. He is Vice President at Revive Health in our Issues in Crisis group. He works across the firm to really prepare and counsel our clients when a crisis or an issue arises. Matt joined Revive Health from HCA Healthcare, where he served as a Senior Director of Strategic Communications for HCA's Gulf Coast Division. He there also oversaw and supported crisis communication efforts for the division and drove reputational and brand initiatives as well. Hey, Matt, glad to have you here.
Hey, thanks for having me.
Sure thing. So as with each show, we plan to cover the latest news in COVID-19 and how it relates to marketing and communications. We want to highlight helpful resources, share what we've been seeing and hearing from a marketing and communications perspective across the industry, and also open the floor for questions. As we get through the show and you have questions that come up, feel free to put those in the question and answer queue. You can also use the chat to talk with other kind of folks and attendees in the podcast here. But make sure that if you're submitting questions and you'd like for us to answer them, that goes in the question and answer queue. You can subscribe to our podcast now on iTunes as well. So feel free to go on kind of your podcast app if you have an Apple product, or on iTunes and search for Revive Health Daily Briefing Live, and you should be able to find it there. We post all of the recordings of our episodes by the end of each day. So visit our website at thinkrevivehealth.com. /COVID-19, and that's where you can find really all of our resources related to the COVID-19 crisis. A couple of important notes before we get into it here. We are not experts on COVID-19, so this is not a place to come for medical or scientific advice. We do have a lot of opinions as it relates to marketers and communicators and how they can manage and might think about managing the COVID-19 crisis from a communication standpoint. But everybody's situation is unique. Every market is unique. And so kind of run everything we say through those filters of, your market and your organization better than anyone does. Yes, included, of course. So let's begin. We want to go ahead and, always start with the latest count. This really helps us to frame the way that we think about this pandemic as it spreads across the nation. It's never the best part of the show, but we think that it's important always as just sometimes in this, it's hard to have an anchor to kind of track with. And so I think ensuring that we're kind of always coming back to the same metrics here as far as the state of COVID-19. We use the Johns Hopkins tool to track this, and when I refreshed it right before the show, the case count globally was 5,534,728, and the death count for that number is 347,587. That's globally. In the United States, our case count is just over 1.66 million. And then the death count on that is getting close to that 100,000 mark that we knew was coming at 98,371. So just to frame the conversation there, obviously not what we want to see right now, but grateful for all of the work that everyone in the medical field is doing to keep that as low as it can be. This is typically the part of the show where we highlight kind of the news happenings, any kind of additional things that we want to make sure that people have from a resource perspective. But that's really the bulk of our show today. We are aware kind of as we just kind of got out of a holiday weekend that a lot of people, a lot of our listeners have been working through weekends, and we hope that you are not tuned into all of the news over the whole weekend. I hope that you are at least got 24 hours of unplugged in here. But a lot of what we wanted to accomplish here was to highlight kind of the key things that have come out in news, and that's reflective of what health systems are dealing with right now, and really make that bridge to what that means for hospitals and hospital communicators and marketers as well. So we'll dive into it. Don't want to steal any of Mike and Matt's thunder here. So guys, since we just had a holiday weekend, the first holiday weekend of during the height of COVID-19, was there anything that kind of came up as states reopened either before or during the holiday weekend?
Hey, it's Mike. I can definitely take the first one here. I think you nailed it right there. It's, the states reopened, many of them during our first outdoor summer holiday weekend cookouts, beaches, pool parties, things of that nature. And there was a lot of coverage. There was a specific CNN article that I saw that, again, noted the death toll nearing that 100,000 mark, which is obviously terrible. But that, there's a lot of Americans out there that are really breaking from that physical distancing guidelines that have been set in place. And this is all sort of in the background with, the new cases continue to rise. I think the stats were 18 states it's continuing to rise, in Georgia, Arkansas, California, and Alabama, just to name a few. And while not everybody was outside, at the beach or maybe at parties, there were some Americans that took what health officials said very seriously, wearing masks in public, continuing to keep their distance from strangers, or celebrating at home with close families who they've likely been isolating with. And I think really the main thing is those precautions are really important right now, because another piece of news that came out actually was that the CDC released some new research that an estimated 40% of coronavirus transmissions happen before even a symptom appears. So while we all may be feeling well and good, there's still potential that we're carrying that virus. And actually that 35% of patients won't have any symptoms at all. So again, I think it goes back to that messaging that, we've talked about on the show. Hospitals have put out, government officials have put out that, it's less about us and more about making sure that we're protecting the others around us by physically distancing. And so I think that really there's just a great opportunity and continued opportunity, I should say, for hospitals to really own that message within their local communities, working with local media outlets to put out that messaging, positioning some of their doctors or experts in the field to, generate that continued awareness of, we're coming out of this, but we're not out of it yet.
Yeah, absolutely. I think it's important, you highlighted the 18 states where cases have been rising still. I think there's a lot of conversation around this kind of flattening of the curve. And I think there's a lot of folks who take that for granted. And I don't think that hospital communicators are taking it for granted at all. I think that there's I think it's a weighing kind of responsibility on marketers and communicators right now, especially in those 18 states. It's not just that the cases are rising; those are new cases per day rising, and I think that that's a metric that's increasingly being turned to as the source of progress. So I think I think that's important. I think, Matt, do you have anything to add on this as far as what happened over the weekend here, and what folks should be aware of as they start this short week?
Yeah, I mean, I think everybody saw some of the shocking photos and videos that came out of places like the Lake of the Ozarks, where there was a big, massive pool party. That's something certainly that health officials, hospitals, health systems have been advising people against, really just asking people to maintain social distancing guidelines, recommendations, as well as following, common sense when it comes to hygiene, wearing a mask and things like that. I think it's important for us to remember that we might have flattened the curve, but we're still in a long, sort of slow plateau of sorts that will likely go on for quite some time. And the actions and behaviors that we take right now are going to determine whether or not that plateau eventually goes down or goes up. So, we'll see what happens in a few weeks if those numbers in some states where it seemed like people weren't following a lot of the guidelines, if those numbers do go back, and if some cities, municipalities, states have to potentially roll back some of their reopening phases.
Yeah, absolutely. And I think that dovetails into kind of the next thing that we were going to cover really nicely, which I think is, as we think about this first big wave of COVID-19, and I say first because it's likely that there's a second, right? There's been a lot of news coverage and also just local praise of hospitals and health systems, doctors and nurses, frontline workers who have really helped to get communities through this. I think regardless in many cases of how hospitals and health systems have handled this, the public is ready and willing in this time with such an unexpected and difficult, pandemic, to give some grace to hospitals and health systems as far as how it was handled in their organizations. Some of how we're thinking about this is that it's unlikely that there'll be a second hall pass handed out in a second wave. As we're starting to see kind of some adverse coverage around hospitals and health systems and how they've handled the COVID-19 crisis to this point. Is there anything that we should be aware of? I mean, you guys can cover some of what those pieces are, but Matt, I'm wondering if you have some thoughts about kind of how we should think about, a second kind of resurgence and what that looks like in light of the fact that states are kind of opening up in many cases.
Yeah, I mean, it comes back down to a lot of the stuff that we've been talking about for the past several weeks. But I think it's really important that hospitals and health systems get out there in the field with some polling, some research, if they haven't already, to really understand whether or not public sentiment around their hospitals have gone up or down. I think without that, you're really flying blind as far as how to communicate what's needed and sort of what's top of mind for the community. We also have to consider the speed with which reopening is occurring in certain communities and certain states. That's certainly a big factor, and that's going to, down the road potentially impact whether or not that curve stays flat, whether it goes up, whether it goes down. So those are kind of the immediate sort of concerns or issues that we certainly need to consider. But as we're looking closer down the line to the fall, we need to start thinking about how we've rolled out communications in the past during bad flu seasons. What happens if there's a second wave of COVID-19 that coincides with the bad flu season? And then what that all means when it comes to testing capabilities and rolling out communications and recommendations for the public. I think that's a major concern that folks have right now, and how that's all going to potentially come to a head in the fall.
Great. So when we think about kind of like, I think framing this conversation somewhat is the fact that even in the first wave, we're starting to see on the other side of this that large employers and even the public are starting to kind of poke holes in some of what's happened. Mike or Matt, do you guys want to just kind of touch on? I know that we noted a Reuters article and a New York Times article kind of ahead of this time, but just kind of summarizing what those had, the sentiment of that and what that might mean for listeners as well.
Yeah, and I can take the Reuters article, but Mike would love to get your thoughts as well. We're seeing employers like Salesforce, Tesla, Walmart, and Boeing in the Pacific Northwest begin to push back on M&A activity amongst hospitals and health systems. They wrote a letter to congressional leaders, I believe it was last week, calling on a 1-year pause or ban on a lot of that activity. Their argument is that this M&A activity is going to lead to worse care for patients, as well as higher costs. I think the concern is also twofold. I think the second part of that is the idea that larger health systems might be predatory against or towards smaller systems that might be in a little bit more of a financial jeopardy than others.
Yeah, and I can build on it. I know there was a New York Times article that I wanted to touch on a bit that really talked to the effect of, it was chaotic. This is something we hadn't seen before. Trainings that needed to be done on the fly made things a little bit even more chaotic. And I think moving forward, having the opportunity, as things do begin to slow down slightly before the potential next wave, this is really the opportunity to kind of go back and look at what worked well, what maybe could we have improved upon and can do so moving forward. What trainings, how can we get staff more prepared, whether it be, within a hospital and health system, or even in a job like some of the companies that you had mentioned, Matt. So what protocols and precautions should be put in place? So that's really what the New York Times article really hit on pretty hard.
Great. Yeah. And I think one kind of follow-up question that I have for you guys, as you think about it's hard, I think, for marketers thinking about what's directly in front of them right now, which in many cases is, convincing their communities that, that the huge strides that they've made in clinical safety and cleanliness are strong enough to warrant people feeling comfortable coming back to a care setting, right? That's where a lot of people's emphasis is right now. As they think about kind of just beyond this, it's not long-term, but it is feeling long-term right now. Matt, you touched on some of this already, but what are the maybe key just considerations for how, as people think about their contingency plans going forward, the key considerations maybe for how people should frame their planning for a potential, longer term thing in the fall, when things come back up? I would imagine that there's some of it around just, are you in a market where public sentiment went up for your health system, or did it go down, right? Like, are there kind of key things that should be focused on there?
Yeah. And kind of what I had mentioned earlier, I think it's really important just to reiterate the need for research and polling, just to get an idea of where public sentiment sits. I think that's going to help you figure out how to communicate, who your audiences are, and what they need. You're kind of flying blind without that. So I think that'd be my first priority. Totally. The second priority is to go back with my team, do a hot wash, figure out what worked, what didn't, and then start building out communications plans, content, stuff that's ready to go, should you need it, if you'll need it in the fall.
Yeah, and I think as people kind of look forward, there's this weird connection point between, the things that that they know that they need to focus on today, and then the things that they know that will be kind of coming down the pike from a marketing and communications prioritization standpoint. It's all in this kind of context and question mark world of, is there anything clinical that has any promise to make the tail on this thing shorter? And that's another thing that popped up in the news and continues to come up in the press right now is, are there future things where there's kind of a possibility for clinical solves, for lack of a better term here. So one thing that we're seeing obviously is that 100 million children around the world are unable to receive their kind of basic vaccines due to COVID-19. That has big effects on public health, obviously, going forward. So I'm curious from y'all's perspective, where are we seeing and what are we seeing as far as impacts for delayed care here? And then is there any element of a kind of vaccination or cure that we should be keeping in mind from a just timing perspective?
Yeah, I can kick us off here. We actually saw an article from Kaiser Health where it was titled actually "Chasing the Elusive Dream of a COVID Cure." So, while we're seeing scientists and even the stock markets, the economy receiving a little bit of a boost there from that approval of the emergency use for remdesivir to treat COVID-19, there's still a lot of belief that, a cure for the coronavirus, remains a long way off and may never arrive, which is, a little disheartening to hear. But at the same time, I think it's the realization that this isn't a short tail thing. We need to continue, moving at the speed we've been moving, the communications wise, the messaging that we're putting out there. And it's just, it's a tough situation.
Yeah, Matt, anything to add when it comes to kind of that, whether it's kind of the lack of vaccinations and what that means for kind of, public health going forward, how communicators should be thinking about that as well?
Yeah, we're seeing and hearing more and more a lot of conversation and chatter about vaccinations for other childhood illnesses. Ones that certainly can be prevented. A lot of kids now are unable to receive their basic vaccines because of COVID-19, just with hospital changes, closures, postponements of care. So I think it's really important as we come out of the tail of the immediacy of responding to COVID-19, to make sure that we're getting pediatric patients, children back in the hospitals, back in clinics, and ensuring that we're communicating with their parents so that it's safe to get back in and do so. Nobody's in school right now, but I think there's a big question of what happens when there's the big rush back to school, if that occurs in the fall. Kids who haven't had their vaccines, if there's an increase of that, if we're going to see outbreaks of other diseases that we haven't necessarily seen in the past. I think that's a big question that's on top of people's minds.
Totally.
That number.
Go for it, Mike.
I was gonna say, I think that number from the World Health Organization, that over 100 million children around the world are unlikely to receive basic vaccines, is just startling. And to Matt's point, could have a massive effect down the road.
Yeah, absolutely. And I think it's just something to add into the arsenal of what hospitals and health systems are really focused on right now. I think, anecdotally, I've heard from some folks here in Nashville and have been asking friends and family and others about their kind of experience with hospital communications, right? Without naming any names of any systems, right? There are people who I know who didn't really hear much from hospitals, any of their care providers, through the kind of height of COVID-19, and have just now recently started to hear some messaging, whether it's through direct mail or through email, that kind of broke the silence, saying, hey, we're safe to come back to you, and please come kind of seek care from a preventative standpoint. Obviously, that's something that hospital and health systems should be doing to drive to ensure that the public knows that that care is safe to seek. But I also think that there's an element of it where we have to keep in sights this pediatric imperative here too. It's not just bringing people back who could potentially end up in kind of those high margin services, which of course is something that we need to be driving from a hospital kind of revenue perspective after one of the most difficult, if not the most difficult time possible in that front. But certainly we have to consider kind of pediatric public health as well as it relates to vaccines. And I think I appreciate you guys kind of bringing that to the forefront here as well. Yeah. Matt, anything to close out that topic?
Yeah, I might also add, I think it's critically important that we're communicating to at-risk groups as well, making sure that those children are being cared for. And we also can't forget that I think the latest unemployment last week was there were 40 million people, new unemployment numbers added to the figures. And, those are a lot of folks whose insurance probably tied to their job. So we need to make sure that we're also communicating ways for people who might be in pretty difficult situations right now to get the basic care for their children.
Absolutely. No more important and also difficult time to do that. And so I think that's a great thing to highlight here as we close out today's show. So that is it for the topic. I can't believe it's already 12:25 and we're wrapping up, but so is such is a 30-minute podcast here. It's crazy. So I don't think that we had anything come through on the Q&A front. So we won't address those. But one key kind of piece of news, just to give you kind of a look into tomorrow's show. One key piece of news that we didn't cover today was really the increased discussion around what happens when hospitals complete their kind of backlogged surgeries. CNBC's Bertha Coombs covered a story from Ochsner's perspective over the weekend. And we'll be back tomorrow with a special episode with our CEO, Brandon Edwards, centered around the kind of longer term effects of COVID-19 for health systems. And we're kind of keenly aware of, as we're working with health systems all across the country, that while some surgery volumes are kind of rebounding as hospitals open, the outlook for 2, 3, 4 months down the road is largely unknown. And so we'll talk through the things that hospital marketers really should have in mind around low acuity and early detection services that are falling by the wayside today. So we're going to cover that tomorrow. Be sure to tune in then. But remember, in the meantime, to visit thinkrevivehealth.com/COVID-19 for a recording of today's episode and all of the content related to the crisis. Subscribe on iTunes if you'd like, and please remember to let others know about this podcast. And we always close this show out the same way. To all of you out there who have been tirelessly working to communicate with your communities around this crisis, hang in there. You're doing incredible and important and amazing work. The skills that you bring as marketers and communicators are going to become more and more important for hospitals and health systems as they look to fare through this crisis. We'll be back tomorrow and every weekday until this thing passes. We'll talk to you then.